The JetStream hot-cold temperature therapy unit features DeRoyal's patented automatic temperature control that regulates the blanket's temperature. In hot therapy mode, the unit operates between 80 and 120 degrees Fahrenheit. In the cold therapy mode, blanket temperature is maintained at 45 degrees Fahrenheit, plus or minus 5 degrees. Studies have found this cold temperature range to be ideal for reducing swelling of soft tissues after trauma or surgery. Before filling the unit, ensure the drain plug is twisted on tightly and that the power adapter is unplugged. Open the latch and lid. Note the water line and ice line marked on the inside of the unit. For hot therapy use, fill the reservoir with hot water to the ice line. For cold therapy use, fill the reservoir with water to the water line. Then add ice to the ice line. Do not overfill the unit. Condensation may collect on top of the unit if the ice or water level is above the ice line. Close and lock the lid. Once the therapy unit is set up for cold or hot therapy, place the therapy blanket over the treatment area with the clear side of the blanket toward the skin. Secure the blanket with the attached straps. Be sure the straps are not too tight and that there are no folds in the blanket that could restrict water flow. Blankets are also available without attached straps. In this case, the clinician will choose a method of attachment such as an elastic bandage. If using a wrap, place the blanket inside the wrap with the clear side facing toward the mesh. Next, attach the therapy blanket fittings to the unit hose by inserting the ends of the blanket tubes into the hose fittings. Push each fitting together firmly until you hear a click. Check for a secure connection by lightly tugging on each hose. After all connections are made and the blanket is secured to the treatment site, plug the power adapter into a 120-volt AC electrical wall outlet and into the back of the unit. An on-off switch is located on the power cord for your convenience. After a couple of minutes, the automatic temperature control will adjust the blanket temperature and maintain it with the proper temperature range. To maximize water flow efficiency, place the unit at or above the therapy blanket and treatment site level. Avoid twisting or kinking the hoses when the unit is running. A solid green light will illuminate, signaling that the unit is operating properly. The motor will cycle on and off in order to maintain the appropriate temperature range in the blanket. As long as the green light is on, the unit is operating properly. A flashing green light will illuminate when the unit is beginning to leave the optimal operating temperature range, but is still in the therapeutic range. This indicates the unit will soon need ice or hot water added to the reservoir. An amber light indicates the unit is working properly, but the blanket temperature is above 65 degrees in cold therapy or below 80 degrees in hot therapy. The reservoir needs either ice or hot water to continue therapy as necessary. To refill the reservoir, unplug the power supply first, then disconnect the hose from the blanket by pushing on the disconnect buttons and empty the unit. Follow the initial filling instructions. A red light indicates the unit is working, but the water in the reservoir is too hot or too cold for use. A flashing red light indicates the unit is no longer functioning properly. Check for a fold, kink, or other restriction in the water flow to the blanket or hose. To disconnect the unit, unplug the power adapter from the wall outlet and the unit. Then disconnect the hose tubes from the therapy blanket by pushing each metal disconnect button at the connection point. Remove the treatment blanket from the patient. After disconnecting the unit, drain the water or ice from the unit by either opening the latch and lid and dumping out the contents, or by opening the latch and lid and unscrewing the drain plug to allow the water to flow out automatically. Next, use a dry towel to collect any remaining moisture. When storing, leave a few dry towels in the unit to collect any condensation that may not have been removed when cleaning. To prevent the hose from kinking, wrap the hose with the hook and loop closure located on the carrying strap. DeRoyal offers a variety of blankets for our JetStream units. They are designed for knees, shoulder, chest, and lumbar, arm and leg, hand and wrist, foot and ankle, cervical, and hip. DeRoyal blanket wraps help insulate the treatment blanket as well as maintain the blanket's position.